Hey everybody, today I'm talking about excoriation, otherwise known as skin picking disorder or dermatillomania. What's the diagnostic criteria and what causes it? So stay tuned. So like I said, today I'm talking about excoriation or skin picking disorder or dermatillomania or whatever you want to call it. And obviously, because I'm talking about a diagnosis, I'm going to read to you a little bit about the diagnostic criteria from my handy dandy DSM. And it's actually fairly simple. The diagnostic criteria states that somebody must have recurrent skin picking resulting in skin lesions and have repeated attempts to decrease or stop the skin picking. The skin picking must, cause significant distress in their life so that they cannot function. And it cannot be attributable to the psychological effects of substance abuse. I don't know if any of you are aware, but some people, when they abuse methamphetamine or different speeds and drugs, they can dig at their face and cause huge lesions that way. And so it can't be attributed to that. And it can also not be better explained by symptoms of another mental disorder, like having delusions or tactile hallucinations where we feel like things are under our skin. I've had patients experience that and they may dig at their skin, but that's for an entirely different reason. So then you're like, well, Katie, then why do I pick at my skin? I'm gonna sit my DSM down because its job is done. So dermatillomania, or what I'm just gonna call skin picking disorder from now on, because that's just too many words, is usually attributed to OCD. And a lot of people who pick at their skin also pull at their hair. Trichotillomania, which I have a video on that if you want to click here to check that out. I talk about that as well. But those are usually very closely linked, have a lot of the same triggers and the same reasons that they even exist in the first place. And so OCD is definitely one of those triggers. And I have my notes here so I don't forget anything. But most individuals who do struggle with skin picking spend at least 1 hour a day picking, thinking about picking, and resisting the urges to pick. Just 1 hour a day. And for many of you, that's actually not that long. When I read that, I was like, oh wow, if you're really struggling, it may be more than that. But it has to be at least 1 hour a day. And many people report missing work, school, and social activities because of their skin picking. People are so embarrassed with what they've done after the picking has happened that they don't go out to that party because they don't know how to cover that up. And now they have this big, gash and they've really picked and there's nothing they can do. And so they'll miss work, they'll miss school, they'll miss that party. And that's where it comes back to the diagnostic criteria, where if it's affecting your ability to function and be present in your life, then it's an issue. And it usually results, obviously, in scarring and tissue damage, as well as infections. So please, if you have something that hasn't healed, that you have picked and picked and picked, and it keeps getting worse, please seek medical attention. Please have them check it out. Make sure that there isn't a deep infection, that it's not getting worse, and that if they need to stitch it up or do something for you, they can, okay? And also, many clients state that they're trying to remove a blackhead or whatever it is, and then they see another imperfection. So it'll start out as one thing, like, oh, I have this thing I think is a pimple, and then it'll move on to like, oh, but I also want to clear these out, and then, oh, and it takes over, and we end up spending hours and hours just picking on our skin and looking at different imperfections and trying to, fix them by picking at them. And also, just like I've talked about OCD and trichotillomania, stress can exacerbate it. It can make it a lot worse. If we're in a really stressful situation, we can find that our skin picking, which may have taken, an hour and a half of our day, is now taking like 4 hours at night and we can't sleep and we're just picking with our big lighted magnifying mirror, until 3 in the morning. Now, okay, so if we think we have this, what do we do? What are our treatment options? Is there anything that we can even do to help with it? And the answer is yes. Just like with OCD, just like with trichotillomania, because it's part of kind of an anxiety component, an anxiety disorder, an obsessive compulsive situation, therapy can really help. I know that sounds crazy, and I know it sounds like it may be a lot of work, and it really is, but there's a lot of things that therapy can do. And finding someone even better that specializes in it can make the help that much more clear and that much more direct, and that much more quickly you can get better. So therapy is the first thing that I always recommend. Just talking about what's stressing us out and talking about our OCD can really help us better manage it. And they can help you implement different tools and techniques to help you get out of this routine of obsessing, I have to do it, and getting back out of that cycle so that you feel like even if the urges come, you're able to not engage. And the second, as always, is medication. And I know many of you don't want to be on medication, and that is always your choice, and that is fine. But if you're really struggling and therapy is not enough and you find yourself sinking deeper into this hole of skin picking, it may be something that's worth looking into. Make an appointment with a psychiatrist in your area, get properly assessed, and see what your options are. I always tell my clients, if things aren't getting better, we at least want to know what all of our options are. Okay? So the therapy that we can do, to go back a little bit, there are two types. Now I talked about obviously just talk therapy, but there are specifics. I did a little research for y'all about what is best with dermatillomania or skin picking or excoriation or whatever we call it, is habit reversal training. And they help you identify situations, stresses, and other factors that can trigger your urges to skin pick. And so then they have you use other tools instead of skin picking to ease the stress and occupy your hands. I know that clay has really helped a lot of my clients who struggle, or silly putty or something like that can keep your hands busy. And the second is stimulus control. And this is where they work to change your environment to help curb the skin picking urges, like wearing gloves, covering up mirrors, things like that. So it's like you're controlling the stimuli around you so that you don't feel the urges to do it anymore. And obviously, when I talked about the medication, SSRIs are the most commonly used. I just had a note there at the end so I don't forget. But as always, if this is something that you find yourself struggling with, if you're spending hours a day picking your skin, thinking about picking your skin, worrying about picking your skin, please seek help. Please find a therapist in your area. Get an assessment from your doctor. However you have to go through your insurance process to get the help that you need, let's start it today, because the sooner we reach out, we know the sooner we'll get better. And please share this video. Give it a thumbs up if you like this topic, and let everyone know, because the more information that we share, the better off we all are, because we're a wonderful community that's growing each and every day. And if you haven't hopped on my website, KatiMorton.com, you might want to get on it. It's a great place to get some extra support when you need it. People have obsessions about doing things a number of times, whether it's cleaning, washing your hands.